The news day continues here on One News Now. I'm Charles Lejano. The Interagency Task Force has finally allowed churches to hold religious gatherings for this upcoming Holy Week celebration. To give us more details about this new resolution, Maricel Halili is joining us on the line. Good afternoon, what are these conditions set by the IATF specifically for the observance of Holy Week?
Yes, Charles. Presidential spokesperson Harry Roque announced earlier that the IATF has approved the opening of churches from April 1 to April 4, meaning religious activities are now allowed to be conducted starting on April 1, provided that they will follow the conditions set by the IATF. This includes, first, there should only be 10% of the venue capacity who will be allowed to enter the worship places. And actually, reservation on venues are encouraged to make sure that there will be a compliance of the 10% capacity limitation. But of course, they still encourage online platforms so that those who want to witness or to celebrate the Mass will have other options. No gatherings or religious activities shall be allowed outside the church. And aside from that, live singing are strictly limited. They will encourage recorded singing. And of course, the local barangays or the local government units and the Philippine National Police will facilitate to make sure that these conditions will be implemented.
I'm hearing that audio-video systems will not be allowed. So how do they intend to manage around this?
Let me clarify that, Charles. Actually, Secretary Roque mentioned about the audio-video presentation or the AVP will not be allowed outside the churches or outside the worship venue while the Mass or the religious activity inside the venue is still ongoing. The logic behind this is because they want to discourage the people to stay outside the church while the Mass is ongoing to avoid, non-compliance of social distancing. So AVPs are not allowed outside the church or outside the worship venue as long as the Mass or any religious gathering is still ongoing.
I understand as well that the public will be prohibited from live singing. How does the church intend to implement this, and does this mean that choir groups are also banned?
Well, they will encourage recorded singing to avoid droplets and to make sure that there will be compliance on social distancing. They actually task the local government units and members of the Philippine National Police to make sure that this will be followed.
Just to clarify, there's 10% capacity within the church and then no activities allowed outside. Are these restrictions only applicable during April 1 to 4, or will these apply even after the 2-week bubble?
This is only applicable, or this will only be effective from April 1 to April 4. And aside from that, Charles, it's also good to take note that Secretary Roque mentioned that only once a day religious activities will only be allowed from April 1 to 4, once a day.
Thanks for that, Maricel. That was Maricel Halili reporting from Mandaluyong. Special Advisor of the National Task Force against COVID-19 warns that not following the vaccine priority list jeopardizes succeeding vaccine supplies from the COVAX facility. The WHO-led facility has also warned that breaches of their agreement with the Philippines on the priority list might compromise future supplies. Despite this, Dr. Ted Herbosa said the IATF is hearing recommendations to update the vaccine priority list and allow non-health workers to receive the shots at the same time as frontliners. Herbosa said some argue that the country cannot wait until all health workers have been vaccinated and that it needs to start inoculating the second priority group and onward simultaneously. Herbosa also pointed out that other countries have adopted such a scheme for their own vaccination drives.
Well, the proposal I saw was an earlier release for the next priority. Because the other recommendation was tapusin muna lahat ng A category and A1. So ang sinasabi, pwede naman mag-parallel Tuloy na natin because that is what most other countries did. So parang yun ang dinidebate. Should we do that or should we wait?
The health department confirms that 7,500 doses of Astrazeneca vaccines have been returned by its regional office from Bicol. In an interview with Radio 5, Health Undersecretary Maria Rosario Vergeire explained that there was a problem with the temperature of the vials. That's why these were returned. Vergeire also said that they reported the incident to the WHO and UNICEF to discuss how to deal with these logistical concerns. While experts agreed that there was a problem with the logger, they clarified that the vaccines can still be used.
It might be from the shipping point. Pero katulad nga ng sabi ko, pag-aaralan pang mas maigi mamaya, no? Sila ay pupunta ng alauna dito sa ating area para po mapag-aralan kung ano nangyari dito sa logger nitong temperature boxes natin. So gusto natin ipaalam sa ating mga kababayan, no, that this is a unique event, no? Hindi po siya nangyari sa ibang mga bakuna. Nakita nila that one of the batches nitong bakunang ibinibigay sa kanila, yung temperature logger was faulty. But for the others, it was okay and the vaccines are okay.
The health department maintains that only frontline health workers must be part of the so-called vaccine substitution list. To give us more details on this, we have Greg Gregorio. He's reporting live from Mandaluyong. Greg, what exactly is the DOH's system for vaccine substitution?
Yes, Charles, according to Health Undersecretary Maria Rosario Vergeire, the current quick substitution list for the ongoing vaccination must only include healthcare workers. Vergeire insisted that under protocols, all healthcare workers must be inoculated first before the country shift to vaccinating the next priority sectors, which are the senior citizens and people with comorbidities. Currently, Vergeire said we have 1.2 million master-listed healthcare workers, but the Department of Health is saying that there's an estimate of 1.8 million healthcare workers. Thus the DOH has also coordinated with other medical societies for them to identify and trace these healthcare workers, for them to receive their first doses of the COVID-19 vaccine. The Department of Health has also instructed the regional health units to oversee the quick substitution list of these vaccination sites in the country to make sure that only healthcare workers are included in this list. Charles?
Right, Greg. So it's clear, only healthcare workers are allowed to be on the substitution list. But then could you tell us more about the vetting process? How can an individual, a healthcare worker, qualify for this list? And how is this taken into context with the other healthcare workers that turned down the opportunity to get vaccinated?
Just for the healthcare workers who turned down the turned down to receive the vaccination, they are instructed to wait for the availability of the next vaccines that they would want them to have. But as to the vetting process of who will be part of this quick substitution list, Vergeire gave an example that the vaccination site must identify the nearest healthcare worker into a vaccination site so that they could easily mobilize these individuals when there are open vials that so that they could prevent the possible wastage and administer these doses to the readily available healthcare workers to receive this jab. Charles?
Right, Greg, we just reported that vaccines, some vaccines, AstraZeneca vaccines, have been returned by Bicol, but these are still safe for use. What's up here? Do you have any updates on this?
Yes, Charles, according to the Department of Health, as per the initial investigation conducted by the World Health Organization, UNICEF, and the Department of Health, the incident was due to a faulty temperature logger in one of the boxes of the delivered Astrazeneca doses to Bicol region. They said that the one box has a high temperature, which led the the regional health unit to return the doses to the central unit. And upon investigation, the temperature of the vials is still well within the potency requirement, thus it can still be used for vaccination. Vergeire added that there is an ongoing investigation at 1 p.m. this afternoon, and we hope to hear another update from the Department of Health soon. Charles?
I will stay tuned for that update, but then do we have any other updates on the overall COVID-19 situation in the country? Do we have any new word on our hospital capacity?
Yes, Charles, according to our treatment SAR and Health Undersecretary Leopoldo Vega, the country's current healthcare utilization rate is at 41%. It is still at low risk, but the occupancy rate for the ICU beds is nearing moderate risk. And since the increase of cases is rapid, and they are seeing more than 50% of the new cases here in the National Capital Region, the Department of Health is trying to expand the allocation of COVID-19 beds in private and government hospitals. For private, Vega said that the 20% allocation of private hospitals must be increased, and the 30% allocation of government hospitals must be expanded to up to 50%. And they will be assisting the hospitals when it comes to augmentation of healthcare workers. And the Department of Health has also said that there are still mild COVID-19 cases admitted in hospitals, which has to be transferred to temporary treatment and monitoring facilities. But the TTMFS occupancy rate now is at 78%. Thus, the Department of Health is already working with the Department of Public Works, DPWH, for the construction of additional TTMFS in the country, as well as construction of more than 300 bed capacity of modular hospitals to augment the hospital beds in the country amid this response we have against the COVID-19 pandemic. Charles?
Right, Greg, we've also been hearing quite a lot about the various COVID treatments that are being pushed for those who have already contracted the disease. How are we doing insofar as the supply of these medicines?
Yes, Charles, according to the Department of Health, the supply of remdesivir and tocilizumab is getting low. But the problem is we don't have the constant supply of this in the country. Thus, the Department of Health has coordinated with manufacturers for these drugs. And according to Undersecretary Vega, we are expecting the arrival of the additional stocks of these drugs within the month. And these allocation or these number of the drugs may be accessed by hospitals, particularly level 3 hospitals in the National Capital Region and some outside the NCR, for them to give it to their patients. According to Vega, they have allocated 5 million pesos to each of these hospitals so they can procure the exact or the amount of drugs they would be needing for their patients. Charles?
Thanks for that, Greg. That was Greg Gregorio reporting live from Mandaluyong. The 4-month countdown to the much-awaited Tokyo Summer Olympics has begun. This comes after the Olympic torch relay was set off by members of the Japanese national women's football team from Fukushima on Thursday. About 10,000 runners will carry the torch across Japan's 47 prefectures and far-flung islands, starting from the site of the 2011 quake and tsunami. But the first section of the relay did not have spectators to prevent large crowds amid the pandemic. And those are the top stories of the hour. Join Sean Yao later at 2 p.m. as we continue to monitor the day's biggest stories. You can also catch One News on Signal Play. Just register for a free account at www.signalplay.com so you can stream One News live anytime, anywhere. I'm Charles Lejano. Mask on, wash hands, and stay safe, Philippines. We are One News.